It started with tiredness. That is all. Just a little more tired than usual. Sandra was 67 years old, a retired postal worker from Virginia, and she figured, well, she had earned the right to be a little tired. 32 years on her feet, rain or shine, delivering mail through summers that felt like walking into an oven and winters that went right through you, tired made sense. So she ignored it, and that decision almost cost her everything. Right now, as you are sitting and watching this, your liver may be sending you signals you do not even recognize as signals. Not pain. The liver cannot send you pain. It has no pain nerves, none, which means you could be destroying this organ for years and feel nothing that you would call a warning. By the time most people find out something is seriously wrong, they are already looking at cirrhosis, liver failure, or a transplant waiting list. And I am not saying that to scare you. I am saying it because most doctors do not have time to explain it, and someone needs to. What I am going to share with you today are 7 warning signs your liver is already in distress. Signs hiding in plain sight that most people, and I mean most people, are dismissing right now as aging or stress or just not enough sleep. I will also tell you the real reasons your liver gets damaged. And you might be shocked to find out it has nothing to do with alcohol. And at the end, I am going to give you a specific protocol, things you can start doing tomorrow morning that can help your liver begin recovering. Stay with me, because what I am about to tell you about the 3rd sign on this list, that one surprises almost everyone. I have spent over 20 years in internal medicine and gastroenterology. I have watched patients come in with late-stage liver disease who had no idea anything was wrong, no dramatic pain, no obvious clues, just a cluster of quiet symptoms they had learned to live with. And every single time, I think, if they had known these 7 things a year earlier, 2 years earlier, the story would have been different. So that is why I make these videos. Not for the patients I see too late, for the people watching right now while there is still time. Before we go any further, what country are you watching from? Drop it in the comments right now. I genuinely want to know who is in this community, and your comment helps more people find this information. Now, let me be direct with you. Everything I share today is based on published medical research and my clinical experience. But your body is unique. If you recognize several of the signs I describe, please take that information to your doctor. This video does not replace a medical appointment. What it does is give you the knowledge to ask better questions and take this seriously. And now let's start with sign number 1, chronic fatigue. And I am not talking about the tired you feel after a long day. I am talking about the tired that does not go away after a good night of sleep. You wake up in the morning already exhausted. You drink your coffee, you get a little lift, and an hour later, the heaviness is back every day, relentlessly. Most people in their 60s and 70s chalk this up to age. And sometimes it is age. But here's what nobody tells you. When your liver is struggling, it stops cleaning your blood efficiently. The toxins that should have been filtered out stay in circulation. They reach your brain, they reach your muscles. Every cell in your body is running on dirty fuel. Think of it this way. Imagine your car's oil filter is completely clogged. The engine technically still runs, but it is working twice as hard. It runs hot, it drags, it wears down faster than it should. That is your body when your liver is not doing its job. The fatigue is not laziness, it is biology. Sandra told me she spent almost 8 months thinking she was just adjusting to retirement. She thought she needed to be busier, or maybe she needed a new hobby. She even joined a walking group at the community center, and she was still exhausted. Pay close attention to this, because this matters. It was not until her neighbor, a retired nurse, looked at her one afternoon and said, "Sandra, your eyes look a little yellow to me," that she finally made an appointment. We will come back to Sandra's story, because what we found when we ran her test changed the way I think about how we miss these things. Sign number 2, bitter taste in your mouth, especially first thing in the morning. You brush your teeth and it is still there. Or you finish a meal and there's a strange aftertaste that does not belong. Some people describe it as metallic, others say it is just off. If you have been living with this, you probably blamed it on your teeth or dry mouth or getting older. Here is what is actually happening. Your liver produces bile, a digestive liquid stored in your gallbladder and released into your intestines when you eat, especially fats. Bile is like industrial strength dish soap for your digestive system. It breaks down fat the way soap cuts through grease on a pan. When the liver is under strain, the bile becomes thick and sluggish. It does not flow at the right times or in the right amounts. It backs up. Sometimes it refluxes all the way into your stomach and esophagus, and that backed up bile, that is your bitter taste in the morning. You are not imagining it. Your liver is trying to tell you something. Sign number 3, and this is the one I said would surprise you. Skin itching without a rash. No hives, no redness, no dry patches. Your skin just itches. Your arms, your legs, your back, worse in the evening and at night. You have probably scratched at it without thinking, or maybe you saw a dermatologist who shrugged and offered you a cream that did not help. Here is why. When the liver is compromised, a class of compounds called bile acids builds up in the bloodstream. These bile acids migrate to the skin and irritate the nerve endings directly beneath the surface. The itch is neurological. It is not a skin problem, it is a liver problem wearing a skin mask. I have had patients spend 2 or 3 years treating a skin condition that was never a skin condition. The dermatologist looks at the skin, because that is what dermatologists do, but the answer was deeper. Sign number 4, bloating and a heavy feeling under your right rib cage. This one gets attributed to a weak stomach almost every time. Your liver sits directly under the right side of your rib cage. When it is inflamed or congested, people often feel a sense of pressure or fullness in that area. And because bile is not being released properly, fat digestion gets inefficient. Partially digested fat reaches the large intestine and becomes food for bacteria. Those bacteria ferment it and produce gas. That is your bloating. That is your discomfort. It is not your stomach being dramatic. It is your digestive system responding to a liver that is not keeping up. Sign number 5, dark urine when you are drinking plenty of water. Not the concentrated yellow you see when you have not had enough fluids. This is a darker color, sometimes brownish, like strong tea, and it happens even on days when you have been drinking water consistently. Here's the biology. When old red blood cells break down naturally in your body, they release a pigment called bilirubin. A healthy liver grabs that bilirubin, processes it, and sends it to the intestines where it leaves the body through stool. But when the liver cannot keep up with processing bilirubin, the pigment accumulates in the blood. The kidneys pick up the excess and it exits through your urine. The urine turns dark. Now, flip that around. If your liver is not releasing bilirubin properly into the intestines, your stool may become pale or grayish, 2 sides of the same problem. If you notice either one of these changes, and they are new, and they are not explained by what you ate or drank, do not wait. Make an appointment. Sign number 6, a yellowish tint to your skin or the whites of your eyes. Jaundice, which is the medical term, is often thought of as a dramatic, obvious condition, and full jaundice is unmistakable. But early, mild jaundice is subtle. It shows up first in the whites of the eyes. People see it in certain lighting and dismiss it, or they are told they just look tired. Next time you are in natural daylight, stand in front of a mirror, pull down your lower eyelid slightly, and look at the white. If there is a yellowish cast, it should not be there. There is a genetic condition called Gilbert syndrome where bilirubin runs a little high naturally and the eyes can appear slightly yellow without any liver disease. If you have been told you have this, it is important to still pay attention to new changes. Gilbert syndrome is not a free pass. Changes in your baseline still need to be investigated. Sign number 7, bruising more easily than you used to. You bump into the corner of a table and end up with a bruise that looks like you were in a car accident. Or you notice bruises you cannot account for at all. Your liver manufactures clotting factors, which are proteins that tell your blood to stop bleeding when you get injured. When liver function declines, the production of these proteins drops. Your blood takes longer to clot. Smaller impacts cause larger bruises. People almost always blame this on thin skin from aging or blood pressure medication or just bad luck. Sometimes that is the case. But if this is new for you, If it has gotten noticeably worse in the past year or two, it belongs in the conversation with your doctor. Let me give you a moment to check in with yourself. Of these 7 signs, how many apply to you? Chronic fatigue, bitter taste in the morning, itchy skin without a rash, bloating and right side heaviness, dark urine, yellowing in the eyes or skin, easier browsing. If 3 or more resonated with you, I want you to ask your doctor to check 4 specific lab values: ALT, AST, bilirubin, and GGT. These are liver enzymes and markers that show up on a standard blood panel. Most doctors will order them if you ask. You do not need to diagnose yourself. You need the information to have a real conversation. If what you are hearing today is helpful, please hit the like button right now. It costs you nothing, but it tells the algorithm that this kind of honest health information is worth showing to people who need it. And there are millions of people who need it. Now, here is where I need to push back on something most people believe without question. And I mean really push back. Because this assumption is responsible for a massive amount of silent, undetected liver damage happening right now in people who consider themselves healthy. The biggest threat to your liver is not alcohol. I know that is the last thing you expected to hear. And yes, alcohol absolutely damages the liver. That is not in dispute. But a 2022 report from Johns Hopkins University showed that non-alcoholic fatty liver disease, NAFLD, now affects roughly 1 in 4 adults worldwide. 1 in 4, and the majority of them do not drink excessively. They are not drinking at all. So what is causing it? Fructose. Specifically, the industrial fructose that is poured into fruit juices, sports drinks, sweetened teas, flavored coffees, and processed foods under the name high fructose corn syrup. Here is what the food industry has never adequately publicized. Your liver processes fructose almost identically to the way it processes alcohol. The metabolic pathway is nearly the same. The end result is the same. Fat accumulates in liver cells. The liver begins to swell. Inflammation sets in. The label says natural. The label says fruit juice. Your liver is processing it the same way it would process a drink at a bar. That is not an exaggeration. That is biochemistry. And this matters because millions of people are drinking what they believe are healthy beverages every single day while their liver is quietly accumulating fat year after year with zero pain, zero obvious symptoms until the 7 signs begin to appear. And by then, the damage is already in progress. Sandra had not touched alcohol in years. She was proud of that. What she had was a daily ritual of fruit juice in the afternoon, a sweetened iced coffee in the morning, and the occasional sports drink when she went walking. She thought she was doing everything right. When I showed her the research on fructose and liver metabolism, she sat quietly for a moment. Then she said, "Nobody ever told me that." And she was right, nobody did, because there is no pharmaceutical solution to sell alongside it. There is no billing code for telling someone to stop drinking juice. The second thing that is quietly overwhelming millions of livers is polypharmacy. That is the medical term for taking multiple prescription medications simultaneously. If you are over 60, there is a good chance you take at least 3 or 4 medications daily: blood pressure, cholesterol, blood sugar, thyroid, a stomach acid reducer, a sleep aid, maybe something for joint pain. Every single one of those drugs is processed by your liver, every single one. You take 5 medications and your liver is running 5 simultaneous chemical jobs 24 hours a day on top of everything else it is already doing. And nobody tells you this. Your cardiologist prescribes one thing. Your endocrinologist prescribes another. Your primary care doctor manages a third. Nobody is looking at the full picture. Nobody is asking, what is the cumulative load on this patient's liver? The system does not have time for that question. I am not telling you to stop your medications. Do not do that. What I am telling you is that it matters to support your liver aggressively with food and lifestyle, especially if you are managing multiple health conditions at once. And I am telling you, it is completely reasonable to ask your doctor, is there anything in my medication list we could revisit? A good doctor will welcome that question. Before I give you the specific foods and the protocol, I want to finish Sandra's story, because I think it matters. When Sandra's labs came back, her ALT was 3 times the upper limit of normal. Her GGT was elevated. Her ultrasound showed a liver that was already showing signs of early fatty infiltration. She had never had a drink-related hospitalization. She had never even considered that her liver was a problem. She was, in her own words, a healthy person. But her liver had been quietly accumulating damage for years. The afternoon juice, the sweetened coffee, the fatigue she had written off as retirement, the itching on her arms at night that she had been attributing to dry skin for 2 years. 2 years. Here is what I need you to hear. When I told Sandra what was happening and what we were going to do about it, she did not fall apart. She was angry for about 5 minutes. Then she got practical. She asked me what to change, and she changed it. And 4 months later, her ALT was back within normal range. Her energy was different, not transformed overnight. Liver recovery is not dramatic or sudden, but her energy was different, better, real. And the itching that she had lived with for 2 years was essentially gone. That is the liver's superpower. Unlike almost every other major organ in your body, the liver can regenerate. It can rebuild damaged tissue. Surgeons can remove more than half of a healthy liver and watch it grow back to near full size within months. No other organ does that. But here is the critical part. That regeneration only works if you stop the ongoing damage. If you keep flooding a liver with fructose and extra chemical burdens while it is trying to heal, the cycle continues. The liver tries to patch itself. You keep tearing the patches. Eventually, those patches turn to scar tissue. Scar tissue is permanent. That is fibrosis. That is the road to cirrhosis. That is the road away from regeneration. So the window matters. And the window is now. Let me tell you specifically what helps. And I mean specifically. Not vague advice about eating better. Exact foods, exact practices, exact timing. Number 1, cruciferous vegetables. Broccoli, cauliflower, cabbage, Brussels sprouts, arugula, kale. These vegetables contain compounds called glucosinolates. When you eat them, your body converts those compounds into substances the liver uses to neutralize toxins. Think of it this way. Without these compounds, your liver's detox enzymes are working barehanded. With them, they have protective gloves on. The efficiency of the entire detox process improves. You do not need massive amounts. A cup of lightly steamed broccoli, a few leaves of kale wilted into a soup, a handful of cabbage in a salad every day, or as close to it as you can manage. Number 2, extra virgin olive oil, 1 tablespoon daily, not more, not heated to high temperature. Research published in the Journal of Hepatology has shown that regular consumption of extra virgin olive oil is associated with reduced liver fat accumulation and lower liver enzyme levels in people with non-alcoholic fatty liver disease. Drizzle it on vegetables. Dip bread in it. Finish a soup with a swirl of it. If you are using vegetable oil or margarine as your primary cooking fat, that is worth reconsidering. The difference in terms of liver impact is significant. Number 3, turmeric. Curcumin, the active compound in turmeric, is one of the most studied anti-inflammatory substances in nutritional medicine. A 2023 meta-analysis reviewed 14 clinical trials and found that curcumin supplementation produced meaningful reductions in ALT and AST levels in people with liver disease. 1 level teaspoon of turmeric powder in a soup, stew, scrambled eggs, or warm milk. Always with black pepper. Always. This is not optional. Piperine, the compound in black pepper, increases curcumin absorption by up to 19 times. Without it, most of the curcumin passes through your system without being absorbed. A pinch of black pepper makes turmeric work. Without it, you are wasting most of the benefit. Number 4, beets. Specifically the compound betaine, found in high concentrations in beets. Betaine helps the liver process and export fat from liver cells. Think of fat deposits in liver cells like furniture that has been shoved into a room with no way out. Betaine helps open the doors and start moving the furniture. Cooked beets, pickled beets, or even beet powder added to a smoothie. 2 or 3 small portions per week. If the color change in your urine after eating beets concerns you, that is normal and harmless for most people. It is just the beet pigment and not a sign of bleeding. Number 5. Green tea. 3 or more cups daily if you can tolerate the caffeine. If not, decaffeinated green tea still contains the key compounds. The catechins in green tea, particularly EGCG, have been shown to reduce liver fat and inflammation in multiple clinical studies. A 2021 review in the journal Nutrients found that green tea consumption was associated with significantly lower rates of non-alcoholic fatty liver disease. Replace one sweetened drink per day with green tea. That is it. Start there. A word about grapefruit. Grapefruit contains compounds called naringenin and naringin that are genuinely protective for liver tissue. However, grapefruit interacts with a significant number of common medications, including statin, cholesterol drugs, calcium channel blockers for blood pressure, certain anti-anxiety medications, and some anticoagulants. If you take any of these, grapefruit can cause your medication levels to spike to dangerous heights. Before adding grapefruit or grapefruit juice to your diet, check the label on every medication you take. Look for any mention of grapefruit interaction. Or ask your pharmacist. Do not assume it is safe without checking. Now here is a bonus that most videos on this topic completely skip. And I think it may be the most underrated liver tool that exists. Oat water, not oatmeal, not overnight oats. Specifically the liquid produced by soaking and gently simmering whole oat grains. Here is how to make it. Take 1 cup of whole oats, not instant oats, and rinse them thoroughly. Soak them in 1 liter of room temperature water overnight, 8 to 12 hours. In the morning, bring the soaked oats and water to a gentle simmer over low heat. Cook for 30 minutes. Strain the liquid. The result is a slightly cloudy, mildly thickened liquid. Drink half a cup, roughly 4 ounces, 3 times a day, 30 minutes before each meal. Serve it warm, repeat for 2 weeks, then take 10 days off. The mechanism is beta-glucan, the soluble fiber in oats. Beta-glucan coats and soothes the digestive tract lining, reduces the rate at which sugar enters the bloodstream after meals, and has been shown to reduce LDL cholesterol levels significantly. By improving the efficiency of digestion and reducing the glucose and fat load hitting your liver after each meal, oat water gives your liver a small but meaningful daily reprieve. Imagine running a filter that is constantly overloaded. Oat water does not replace the filter, but it slightly reduces what goes through it every single day. Over weeks, that adds up. If you have celiac disease or a gluten intolerance, consult your doctor before trying this. Pure oats are naturally gluten-free, but many commercial oats are processed in facilities with gluten and can be contaminated. Look for certified gluten-free oats if this applies to you. Now, I need to address 3 things people do that they think are helping their liver and are actually either useless or dangerous. The olive oil and lemon juice liver cleanse. You have almost certainly heard of this. The idea is that drinking large quantities of olive oil mixed with lemon juice will flush gallstones out of your liver. What actually happens is that the combination of oil and stomach acid causes a saponification reaction inside your digestive system. It produces greenish, waxy pellets. People see those pellets in their stool and believe they have passed gallstones. They have not. Those are soap pellets created by the chemical reaction in their gut. Real gallstones are calcified, dense, and cannot be flushed out by olive oil. If you actually have gallstones and one of them dislodges and gets stuck in a bile duct, that is a medical emergency. This so-called cleanse has sent people to the hospital. Please do not do it. The idea that small amounts of alcohol are good for the liver, for the heart, the data is complicated and increasingly disputed. For the liver specifically, there is no safe amount if your liver is already compromised. If your enzyme levels are elevated, if you have been told you have fatty liver, if multiple signs on today's list apply to you, any alcohol is adding fuel to a fire, not fanning it slowly, adding fuel. Herbal liver supplements taken without guidance. Milk thistle, dandelion root, licorice root, and several other plants have studied compounds that may support liver function. But they are also processed by the liver. High doses, the wrong combinations, or using them alongside certain medications can stress the organ further rather than help it. Before starting any herbal supplement intended for liver support, have that conversation with your doctor or pharmacist. Natural does not mean without consequence. I want to come back to something I mentioned earlier because I think it deserves more space. The fact that your liver has no pain receptors is not just a curious biological footnote. It is the central reason why liver disease is consistently caught too late. Think about how pain works in the rest of your body. You twist your ankle, pain fires immediately. You have a kidney stone, the pain is so severe it sends people to the emergency room. Your appendix gets inflamed, and within hours, you know something is catastrophically wrong. Pain is your body's emergency broadcast system. Most organs have it. The liver does not. The liver is the one major organ in your body that has opted out of the alarm system. And that was fine for most of human history when the threats to liver health were obvious, when alcohol was the primary culprit and you knew if you were drinking heavily. But in a world where the threats are invisible, where fructose hides in a bottle labeled 100% natural, where prescription polypharmacy has become the quiet standard for aging in America, the liver's silence has become its most dangerous feature. And here is what nobody in a 7-minute doctor's appointment has time to tell you. The liver does not begin to swell, does not push against its capsule and create the heaviness you might actually feel until the damage is already significant. By the time you feel something you would describe as liver pain, you are usually past the early intervention window. The 7 signs I share with you today are not liver pain. They are the liver communicating through every other system it can reach: skin, digestion, energy, eyes, urine, blood clotting. The liver finds every back channel available because the front door, the pain signal, is locked. Learning to read those back channels is one of the most protective things you can do for your long-term health. I also want to address something directly. There is a version of this conversation that is about fear. I am not having that version. Fear without a path forward is just stress, and stress is itself a liver burden. What I want you to take from today is something different. Call it informed urgency. You now know what to look for. You know what is worth asking your doctor about. You know which habits are quietly putting your liver under strain. And you have specific alternatives. You have a protocol, you have a timeline. You know that week 1 is hard and week 3 is usually where it clicks. That is not a reason to be afraid. That is a reason to act. And there is an enormous difference between those two things. Sandra did not leave my office scared. She left with a list, a specific, actionable, completely doable list of things to start in the next 24 hours. And 4 months later, sitting in that same chair, she told me that changing those habits had not just improved her labs, it had given her an energy she thought she had permanently lost. She thought that fatigue was who she had become in retirement. It was not. It was what her liver was doing to her, and she got it back. What you carry out of today's video matters. Not just the information, but what you do with it in the next hour. So here is my ask. Do not let this be another video you watched that felt useful and then disappeared into your queue. Pick one thing. One. Maybe it is the morning glass of water before coffee. Maybe it is swapping tomorrow's afternoon juice for green tea. Maybe it is pulling out the labels on your medications and checking for grapefruit interactions. One thing. Today, that is how health actually changes. Not in dramatic overhauls, in one thing, consistently, long enough to become habit, and then the next thing, and the next. That is how Sandra did it. And that is how you can too. Now I want to talk about the lifestyle side of this. Because food alone is not enough. The way you live around food matters just as much. Water, specifically the amount and the timing. Your liver filters roughly 1 liter of blood per minute, every minute. To do that efficiently, the blood needs to be at the right viscosity. Too concentrated, and the liver has to work harder to push it through. The general guidance for liver health is 1.5 to 2 liters of water per day. And the single most important glass is the one you drink first thing in the morning, before coffee, before food, before anything else. Your body loses roughly half a liter of water while you sleep through respiration and sweating. Your blood is slightly thicker when you wake up. That morning glass of water begins thinning and hydrating the blood before your liver has to process the day's first food. Think of it as rinsing a filter before you run dirty water through it. Evening eating habits. This one is harder because it runs against the social grain, but it is real. Your liver operates on a circadian rhythm. During the day, it is in active metabolic mode, processing nutrients, synthesizing proteins, clearing toxins. At night, roughly between 10 p.m. and 2 a.m., it shifts into a repair and detoxification phase. If you eat a heavy, fat-rich, or sugary meal at 9 or 10 at night, you pull your liver back into active digestion mode right when it was supposed to be healing. Over time, this interrupts the repair cycle consistently. The practical suggestion is to finish your last significant meal by 8 in the evening if possible. If you are hungry later, water or herbal tea. This is not about weight loss or fasting ideology. This is specifically about giving your liver its repair window. Diaphragmatic breathing. I know that sounds clinical, but stay with me for 30 seconds because this is genuinely underappreciated. Your liver sits directly beneath the right side of your diaphragm. When you practice slow, deep belly breathing, your diaphragm moves up and down with each breath. That movement creates a gentle massaging pressure on the liver above it. It improves local blood flow. It encourages bile movement. It literally helps the liver drain. 5 minutes every morning. Inhale slowly through your nose for 4 counts, feeling your belly expand. Hold for 2 counts. Exhale through your mouth for 6 counts, drawing your navel toward your spine. 10 cycles. 3 minutes total. People who have done this consistently report reduced right side heaviness and improved digestion within 2 to 3 weeks. There is no pill that does what consistent diaphragmatic breathing does for liver circulation, and it costs nothing. Sleep timing. Not just sleep duration, sleep timing. Multiple studies, including a 2021 paper from Johns Hopkins University's Gastroenterology Research Group, have linked disrupted circadian rhythm to impaired liver detoxification. Shift workers, people who stay up past midnight regularly, and people who sleep inconsistently across the week all show measurably higher liver enzyme levels on average compared to those who sleep on a consistent schedule aligned with daylight hours. If you are in bed by 10:30 and up by 6:30, your liver gets its optimal repair window. That consistency matters more than most people realize. Now, let me give you the expectation setting conversation that nobody gives you, because this is the part where most people quit. If you start making these changes today, here is what the first week will probably look like. You will not feel dramatically different. You may feel slightly worse before you feel better as your body adjusts to less sugar, different fats, and increased water. Some people experience mild headaches or fatigue in the first 3 to 5 days when cutting sweetened beverages. This is real and it is temporary. Do not interpret feeling worse as the changes not working. Interpret it as your system recalibrating. Week 2 usually brings the first small notices. The morning bitter taste may begin to ease. Sleep quality may improve slightly. Energy dips may be less deep. These are subtle. Do not expect a revelation. Expect a quiet shift. Week 3 is often when patients call me. Not because something went wrong, because something went right. The fatigue that has been sitting on them for months lifts a little more than they expected. The bloating that they normalized as just how their digestion works eases. One woman I treated called it a quietness. Like noise she had stopped hearing because it had always been there, suddenly went down. Month 2 is where the lab values begin to tell a story. If you had elevated liver enzymes, a recheck at the 8-week mark will often show meaningful improvement. Not necessarily normal, but moving in the right direction. And that data point, that first evidence that your choices are producing biological change, is what turns a behavior change into a permanent commitment. Most people quit in the first 10 days because they do not feel the change yet. The change is happening. You just cannot feel liver regeneration the way you can feel a muscle getting sore. The work is invisible, but it is real. Stick with it past day 10 and you will begin to feel it. Here is something I want you to do right now before you close this video. Write down 2 or 3 of the signs I described today that you recognized in yourself. Keep that paper somewhere visible. Kitchen counter, bathroom mirror. Those words are your motivation. Those symptoms are what change looks like before the lab values confirm it. And if this information helped you today, if you recognize yourself in any part of what Sandra went through, I want you to share this video with one person, not a group text, one person, your sister, your husband, your neighbor who you know has been tired for 2 years and blaming it on getting older. You know who it is. That share takes you 30 seconds. It might change the entire arc of their health. Type the word liver in the comments right now if you made it to this point in the video. I read the comments. I want to know you were here. Let me do a rapid recap because we covered a lot. The 7 signs your liver is struggling. 1. Chronic fatigue that sleep does not fix. 2. Bitter or metallic taste in the morning. 3. Itchy skin without a rash, especially at night. 4. Bloating and heaviness under the right rib cage. 5. Dark urine when you are well hydrated. 6. Yellowing in the whites of your eyes or skin. 7. Bruising more easily than before. 3 or more means ask for an ALT, AST, bilirubin, and GGT test. The 2 biggest hidden causes of liver damage are fructose in sweetened beverages and the cumulative burden of multiple medications. The 5 most evidence-supported foods for liver recovery are cruciferous vegetables, extra virgin olive oil, turmeric with black pepper, beets, and green tea. The bonus protocol is oat water, half a cup before each meal for 2 weeks. The 4 lifestyle pillars are morning water before anything else, finishing dinner by 8, daily diaphragmatic breathing, and consistent sleep timing. And the 3 things to avoid are the olive oil and lemon juice cleanse, alcohol if your liver is already compromised, and unsupervised high-dose herbal supplements. Next week, I am covering something that connects directly to what we talked about today, thyroid function in your 60s and beyond. And specifically, why thyroid problems are so frequently misdiagnosed in older adults, and why the standard reference ranges your doctor is using to tell you your thyroid is fine may have been calibrated for a population that does not look like you. That one is going to reframe something for a lot of you. Make sure you are subscribed and the bell notification is on so you do not miss it. Do not let anyone tell you it is too late, because it is not. The liver you have right now can still recover. The signs you recognize today are not a death sentence. They are an early enough warning. Use it. I will see you next week. All content in this video is provided for educational and informational purposes only and is not intended as medical advice. Patient cases described represent composite clinical patterns based on published research. Individual results vary significantly. If you have symptoms that concern you, please consult your physician. Do not start, stop, or change any medication or supplement regimen without consulting your healthcare provider. References for all research cited in this video are listed in the description below. One more thing I want to be specific about before we close, because this is the section where I see the most confusion. Drug interactions and your liver. If you take a statin for cholesterol, a class that includes atorvastatin, rosuvastatin, simvastatin, and others, your liver is processing that medication every single. Statins are generally considered safe for the liver at prescribed doses, and for most people, they are well tolerated. But if your liver enzymes are already elevated before you start, your doctor should be monitoring your ALT and AST regularly. If you have never had those values checked while on a statin, ask for them at your next appointment. If you take acetaminophen, which is the active ingredient in Tylenol and also hidden in dozens of combination cold, flu, allergy, and sleep medications, the liver processes all of it. The critical risk is taking multiple products that each contain acetaminophen without realizing the combined dose is too high. If you take Tylenol for a headache and a nighttime cold medicine that also contains acetaminophen and a prescription pain medication that also contains it, you can exceed the daily safe limit without being aware. 4,000 milligrams is the maximum daily dose for a healthy adult liver. For someone whose liver is already under stress, even less than that may be too much. Read labels. Count your combined acetaminophen intake across all products every day. If you are unsure, ask your pharmacist. That 5-minute conversation could matter more than most conversations you have had about your health. And if you are taking warfarin, which is a blood thinner, many of the foods I mentioned today, including green tea in high quantities, turmeric in therapeutic doses, and certain cruciferous vegetables eaten in very large amounts can interact with warfarin's effectiveness, not to a dangerous degree from normal food portions, but enough that if you are on warfarin, you should discuss any significant dietary changes with your care team before making them. I want you to use every tool in this video. I also want you to use them safely.